you, and thank you to Barnett for having me, and thank you to all of you for giving up your busy mornings and afternoons to spend a little time hearing about some thoughts on audit strategies, so I appreciate everyone's attendance. Just kind of a little bit of a start here. We'll go through the objectives. I'll do a little bit of an intro about myself, and then we'll try and get really into the meat of the details here about audit. One of my goals is for you to leave the session today with some real strategies as to how you can apply some of this information in your day-to-day lives. And I see some of you are from quality assurance, some of you are from clinical, some of you kind of didn't say. So I'm really going to focus on both the clinical component and the quality component. So the first learning objective is to understand the value of the reference model in organizing your audit. And this really helps become very efficient in your identification of GCP compliance. We'll talk about first some strategies for conducting an audit of the TMF and how you can use the power of the eTMF to make your audit a little bit more effective. And then some strategies for auditing a TMF that really focuses on those artifacts that I think have a big impact on quality and GCP compliance. I'll tell you a little bit about myself. Been in the business for 25 years, have spent the first 15 years in large pharma in early development, in ClinOps, and then the last 10 years as an industry consultant that works with organizations around really all facets of inspection readiness. And in the last 5 years, there's been a tremendous focus within the industry around trial master file and really how the first face to the regulator is what's in your TMF, because let's face it, you can have the most amazing trial out there, but if you don't have the documentation to support that it was conducted to good clinical practice, then you're not going to be able to get very far in terms of getting the drug to the patient. So I have done a lot with compliance over the last several years, and in terms of the trial master file, I've been on the reference model committee now for several years, and most recently, I chaired the Zone 4 with his ethics revisions, and then I served on several other zones. And so I'll just tell you that it was a great opportunity to let my experience be heard and to put some practical, I think, application to the new version of the reference model. And then I have a fair amount of experience in Part 11 compliance, both in terms of clinical systems as well as TMF systems. Okay, so now on to the meat. Just before I start, I really want to focus on audit. And so when I think of, a lot of people just kind of use the term audit and QC interchangeably. And I think they both have different process, and I actually think they both have different outcomes to some degree. So this morning, the session we did this morning focused on QC, that very specific information oversight. In my mind, QC is very data-driven. Audit, I think of more as process. We use the data, we use the information to evaluate the process, but for me, audit is really about making sure that everybody kind of followed the processes that they needed to, and that's evidenced by the data that we're looking at. And I'll get into the meat of that a little bit more as we progress. So what's the definition of a TMF? So really important here is the term standalone. The TMF really does need to be a standalone set of documentation or records that really can stand by itself. It doesn't need a whole lot of additional explanation, that the regulator can look at the record and really understood what happened. And as an auditor, that's really important. Can you look at the TMF and really understand what happened with the study? If you have a question in one part, you can find the answer someplace else, because that's really going to be what supports the story of what happened during the study and how the study was conducted. It's that collection of documentation that allows you to evaluate the conduct of the trial in terms of data integrity and compliance with GCP. So it's really this output from all functional areas. And I use the term functional area very specifically here because historically, and when I certainly a long time while I was in the business, the TMF was a clinical product. It was collected by clinical and was an output of clinical. And today it's very, very different. The TMF is the total story. And so each of your functional areas, such as data management, biostatistics, clinical trial materials, they're all functional areas that contribute to the TMF. So I think it's really important to think of the TMF as well beyond those, quote, essential documents of yesterday.